8 signs that you may have cancer. Explain each warning sign in simple language. Let's explore these important health indicators. Unexplained weight loss. Losing weight without trying can be concerning. This can happen when cancer cells use up energy, or when they affect how your body processes food. If you've lost weight without changing your diet or exercise, see a doctor for evaluation. Extreme fatigue. Feeling exhausted even after rest is different from normal tiredness. Cancer can cause fatigue by affecting your body's energy production, or by causing changes in your blood. If extreme tiredness doesn't improve with rest, encourage seeing a doctor for evaluation. Warning sign number 3, lumps or swelling. This is perhaps one of the most widely known potential signs of cancer, but it's important to understand the details. The discovery of a new lump can be alarming, but remember, the vast majority are benign, meaning non-cancerous. So what constitutes a lump? It can be a distinct mass, a firm knot, or even just a thickened area of tissue that feels different from its surroundings. These can appear anywhere on or under your skin, commonly in the neck, armpits, groin, abdomen, breasts, or testicles. They can be painless or tender, movable or fixed in one place. While it's impossible to self-diagnose, a key takeaway is that a painless, hard, and immovable lump is often more concerning and requires prompt medical evaluation. Lumps related to cancer can form in 2 primary ways. First, they can be a primary tumor. This happens when abnormal cells multiply uncontrollably, creating a mass in a specific area, like the breast or a muscle. This is the cancer itself, growing in one location. The second way is through your lymphatic system. Think of this system as your body's drainage and filtration network, crucial for your immune response. It includes lymph nodes, which are small glands that filter out harmful substances. When cancer cells break away from a tumor, they can travel through the lymphatic system and get trapped in these nodes, causing them to swell. This is why persistent, swollen lymph nodes in your neck, armpits, or groin, especially without any other signs of infection like a cold, can be a warning sign of a cancer like lymphoma, or of cancer that has spread from another part of the body. This highlights the importance of being familiar with your own body. Regular self-examination is a powerful tool. By knowing what's normal for you, you're better equipped to notice any changes early on. For example, women are encouraged to perform regular breast self-exams, and men, testicular self-exams. The goal isn't to diagnose, but to detect. So, when should you see a doctor? Make an appointment if you discover a lump that is new, has noticeably grown in size, feels hard and doesn't move, or has been present for more than 2 to 3 weeks. During your visit, the doctor will perform a physical exam and ask about your medical history. They'll want to know when you first noticed the lump and if it has changed. Based on this initial assessment, they may recommend further tests to get a clearer picture. This could involve imaging, like an ultrasound, which uses sound waves to create a picture, or a mammogram. In some cases, a biopsy may be necessary. This is a simple procedure where a small sample of the tissue is removed and examined under a microscope. This is the only definitive way to determine if a lump is cancerous. Any new or growing lump needs professional medical attention. Don't dismiss it or wait, hoping it will disappear. Taking charge of your health by seeking a prompt evaluation provides you with either the peace of mind that it's nothing to worry about, or the critical advantage of early detection and treatment. See a doctor for a thorough evaluation. Our 4th warning sign focuses on your body's largest organ, your skin. Visible changes on your skin's surface, including new or evolving moles, unusual growths, or a yellowing of the skin known as jaundice, can be important health indicators that you shouldn't ignore. When it comes to skin cancer, early detection is paramount. Pay close attention to any changes in existing moles or the appearance of new, unusual spots on your skin. A helpful tool for monitoring these changes is the ABCDE rule of melanoma. A is for asymmetry. One half of the mole does not match the other. B is for border. The edges are irregular, ragged, or blurred. C is for color. Look for uneven coloring, with multiple shades of brown, tan, black, or even patches of red, white, or blue. D is for diameter. The spot is larger than 6 millimeters, about the size of a pencil eraser. And E is for evolving. The mole has changed in size, shape, color, or elevation, or you notice new symptoms like bleeding, itching, or crusting. While melanoma is the most serious type of skin cancer, also be aware of other forms, like basal cell carcinoma, which might look like a pearly or waxy bump, or squamous cell carcinoma, which can appear as a firm red nodule or a scaly, crusted flat lesion. These skin changes occur when there is uncontrolled growth of abnormal skin cells. This is often caused by unrepaired DNA damage in skin cells, most commonly from exposure to ultraviolet, or UV, radiation from the sun or tanning beds. These damaged cells multiply rapidly, forming malignant tumors. Another significant skin change is jaundice, which is a yellowing of the skin and the whites of the eyes. Jaundice itself isn't a disease, but a visible sign of an underlying issue. It happens when there's too much bilirubin, a yellow pigment from the breakdown of red blood cells, in your blood. Normally, the liver processes bilirubin. However, cancers such as pancreatic or liver cancer can block the bile ducts or impair liver function. This prevents bilirubin from being properly drained, causing it to build up in the bloodstream and deposit in the skin, leading to the telltale yellow discoloration. Protecting your skin is a critical preventive measure. Practice sun safety by seeking shade, wearing protective clothing, and generously applying a broad-spectrum sunscreen with an SPF of 30 or higher. And it's crucial to avoid indoor tanning beds. Performing monthly skin self-exams in a well-lit room with a mirror can help you become familiar with your skin's landscape, making it easier to spot any new or changing features. If you notice any of these changes, a suspicious mole, a new skin lesion, or the onset of jaundice, it is essential to have them evaluated by a doctor or dermatologist promptly. Remember, most skin cancers are highly treatable when detected early. Viewing a checkup as a proactive and empowering step for your health can make all the difference. Unusual bleeding. Bleeding that's new, heavy, or happens between periods. This can happen when cancer affects blood vessels or disrupts normal tissue function. Unusual bleeding should always be investigated. See a doctor for evaluation. Our sixth warning sign focuses on two symptoms that are easy to dismiss: a chronic cough or changes in your voice. While often harmless, their persistence can be your body's way of signaling a more serious underlying issue that warrants attention. Let's first talk about a chronic cough. We're not referring to the cough that accompanies a common cold or flu, which typically resolves within a couple of weeks. A chronic cough is one that lingers for 8 weeks or longer in adults, showing no signs of improvement. It might be dry and hacking, or it could produce phlegm. A particularly alarming sign is coughing up blood, even a small amount. This persistence is the key differentiator. Cancers of the lung, throat, or thyroid can cause such a cough by directly irritating the airways, or as a tumor grows and puts pressure on surrounding tissues and nerves. Similarly, let's consider voice changes, medically known as dysphonia. It's normal for your voice to become temporarily hoarse or raspy after shouting at a concert or during a bout of laryngitis. However, if your voice remains hoarse, weak, or strained for more than 2 or 3 weeks, it's time to investigate further. This could manifest as a consistently raspy quality, a change in your normal pitch, or finding it difficult to speak above a whisper. This can be a direct symptom of laryngeal cancer, affecting the voice box itself. It can also be an indirect sign where a tumor in the chest, lung, or thyroid presses on the recurrent laryngeal nerve, which is crucial for controlling the muscles of your vocal cords. Certain lifestyle factors significantly increase the risk for the cancers associated with these symptoms. Smoking and tobacco use are the #1 cause of lung and laryngeal cancers. The risk isn't limited to smokers. Exposure to secondhand smoke is also dangerous. Other risk factors include heavy alcohol consumption, exposure to environmental toxins like asbestos and radon, and certain strains of the human papillomavirus, or HPV. The most powerful preventive steps you can take are to quit smoking, avoid tobacco products, moderate your alcohol intake, and for younger individuals, consider the HPV vaccine, which can prevent many types of head and neck cancers. It's important to remember that most persistent coughs and voice changes are caused by less severe conditions like allergies, acid reflux, asthma, or benign vocal cord polyps. The goal is not to cause alarm, but to encourage awareness. If you experience a cough or hoarseness that just won't quit, schedule an appointment with your doctor. They will listen to your concerns, review your medical history, and perform a physical exam. Depending on your symptoms, they may recommend a chest X-ray, a CT scan, or refer you to a specialist like an otolaryngologist, an ear, nose, and throat doctor, or a pulmonologist. Early evaluation leads to an accurate diagnosis, whether it's a simple issue or something more serious. Listening to your body and seeking professional advice is the most proactive step you can take for your long-term health. Digestive problems that don't go away, ongoing stomach pain, nausea, or changes in bowel habits. These can happen when cancer affects digestive organs, or when tumors block normal digestion. Persistent digestive issues should be evaluated. See a doctor for evaluation. Persistent pain. Pain that doesn't go away or gets worse over time. This can happen when cancer presses on nerves, or when it spreads to bones or other tissues. Ongoing pain should always be investigated. Encourage seeing a doctor for evaluation. If you notice any of these, consult your doctor. Early detection saves lives. Take care of your health today.